think about diabetes in primary care, how do you think things are changing and evolving and moving on?
When I first started in general practice, sort of 20 years ago, diabetes had a much lower profile. There were fewer diabetics, but also too, more of the care was delivered in secondary care. Fewer general practitioners had expertise in managing diabetes, but particularly with the NSF, with the new GP contract and QOF, there's been very much a drive to move the care of diabetes into primary care. So general practitioners have been forced to actually become familiar with this condition and deliver it. And as you can see with QOF points, by and large general practitioners are becoming more successful. And coming back to the increasing incidence of diabetes means that hospitals could not cope with it. So it's now become much more a primary care disease, and only specialists, smaller groups of patients are normally going to be seen by secondary care, i.e. pregnant women that I alluded to before, children and adolescents with diabetes. But the vast majority of the remaining patients, particularly if they're uncomplicated, should be managed successfully and well by their own GPs.
In your experience, is that something that patients welcome as well?
Yes, I mean by and large, there is the knowledge in developing the technical stuff, but as alluded to before, there's also the relationship with the patient. And so, although I may not be as knowledgeable as the hospital consultant, and I might not have access to the equipment that he has, I have a greater knowledge of the patient. And the patient may feel more comfortable discussing the various issues with a team of people that they know, rather than having a strange doctor every 6 months who may be very knowledgeable but doesn't know them in the midst of a busy clinic.
So that continuity is quite valuable.
Yes, and when they come, they may not just discuss their diabetes, because at the end you're also looking at the whole person. You have to integrate that into all the other issues that may arise. Patients who come to diabetic clinic will see the nurse and they say, I want to see the doctor. Most of the time it may be related to some aspect of diabetes, but they'll say, oh, while I'm here I have some other issue that they want to raise with you. So that is something that does arise.
So that sounds like a positive development of the last 20, 30 years or so, the move from being concentrated in secondary care to primary care. Any other positive developments that you'd like to highlight?
Yes, I think that we are actually better at managing diabetes now, because we've moved away from not just managing blood sugars, the sugar, the metabolic component, but back to what I was again saying before about cardiovascular risk. And I think that in primary care we are increasingly adept at being able to do this, that I think most general practitioners feel much more competent now about managing blood pressure, cholesterol, and health education, for example smoking, and particularly also what has really helped us is the development of practice nursing, because practice nurses now are as good, I think, as most doctors at delivering this. A lot of them now are developing, are allowed to prescribe, so that this is something that I think can be managed quite well in primary care, and I think there are a range of people around who can do this.
This work was produced as part of the Tiger project and funded by JISC and the HEA in 2011. For further information, see www.northampton.ac.uk/tiger. This work by the Tiger project is licensed under a Creative Commons Attribution Non-Commercial Share-alike 3.0 Unported license, based on a work at tiger.library.dmu.ac.uk. The Tiger project has sought to ensure content of the materials comply with the CC by NC SA license. Some material links to third-party sites and may use a different license. Please check before using. The Tiger project nor any of its partners endorse these sites and cannot be held responsible for their content. Any logos or trademarks in the resource are exclusive property of their owners, and their appearance is not an endorsement by the Tiger project.